All right, welcome to another podcast here. And he's been on the show before, special guest, Dr. Ryan Crotin, one of my favorite guests on the show. And we've got a lot of fun things to talk about. How's it been, Ryan?
Oh man, it's amazing. For people who have been following along, Brent put out some amazing content involving myself and Jordan Osigura. We came to Top Velocity, and really, I didn't know what to expect. And Brent is a phenomenal marketing person, and not only that, is the detail and depth that we got into conversations was mind blowing. I think we had over I counted it. There's 3.5 hours worth of education for free for people to kind of get the insights in terms of Brent's perspective, and kind of just try to blend our element of identifying strength deficiencies and imbalances. But we're talking about the subject today is the strength and coordination element, because we got into your training philosophies with Olympic lifting, and that's like kind of the highest order of type of training to get an athlete to. So I'm excited to chat about all of this stuff.
Yeah, and you did some really great presentations when you were here, and we put those together on our YouTube. So if you go to the Top Velocity YouTube channel and search arm care or Dr. Ryan Crotin, you'll get all those presentations, and they're chock full of great knowledge on arm care, on performance, on just a lot of new age science, definitely better education, better way of looking at health and performance in baseball. So, I mean, I thought those came out pretty good. Didn't you like the presentations?
I loved them. And I love education. It's amazing that I'm being invited to a bunch of different places to speak. One at the ABCA conference at the Tech Expo, and the other just put some stuff out for Buddy Biancala, which is Zone Motion. That's coming out. And now for the baseball performance summit. But Brent, what we were able to do, with just get me a whiteboard, having the slides up on the big screen that you got in the centerpiece of the facility, and then getting Instagram Live, it was just eye-opening to me, man. It's just seeing how connected we can be with a baseball audience. And that I like that class environment, because I was an instructor while I was doing my PhD first, and I know I've been watching your stuff for a long time. Actually, the way I found you is that someone's like, hey, this guy's presenting our conference poster on YouTube.
Oh yeah, I remember that.
And it was the first time that anybody had ever seen any of my work, and I was like, what the heck,
Yeah,
So
well,
I knew I had
you've
to.
got great work. I mean, eventually it was going to get out there, right?
Oh man, I had to check into it, and I know we've had some great conversations. I mean, I guess I'm going to name drop, but you did a fabulous interpretation of what you saw in Shohei Ohtani's delivery, and that
Yeah,
was
that was
another
fun.
time where I reached out to you, and it was just like, man, like, and you were spot on, dude.
Well, it
There was
was
some hip
fun. I mean,
restriction
you
going
were
on.
helping me learn kind of what it's like working with someone at that level. I'd never really worked with someone that level. So, I mean, it's pretty wild hearing the experiences like you were having with those guys and stuff. And
Yeah,
and also it's also wild when I don't think people realize this, but guys at that level have everyday problems. They have same problems you probably have. They're just
yeah.
dealing with it at a higher level,
Yeah, and the other thing too, I mean, me being in professional baseball, and I'm not saying I'm unique, but I do have the intellectual humility to, when I see something that's outside of the walls of a major league team, and I'm getting information that resonates with me that's good. There's two things I don't do. One, I don't bastardize it and say it's my own. And two, I reach out to that person to make him an ally. Because the more you pad yourself with great insights, and you can step back and say, well, I don't know all the answers, or not be so provincial with players, saying, okay, well, here's Brent Pourciau. He's got his his program, his company, but these are my guys. You know, I'm with, you know, let's just say Angels, you know, this is my player with the Angels. And I'm not going to talk about that player. And I'm not going to promote this other person to work with them. And I see this all the time, and it really limits what you're doing for the player. Because honestly, think about it. Like it's with my kids. I find it funny all the time. My son Cameron is small. He's 3 years old. And every time I look at him, I'm like, man, when are you growing? And then he gets in front of my parents who haven't seen him for a very long time. And they're like, oh my gosh, Cameron has grown so tall. You know what I mean? And so it's like a case in point in coaching. We get blinders and we don't ask for help. Our egos can get in the way.
A lot.
And I remember when I was talking, to you, I was like, dude, and you were kind of like the first to do a lot of the mechanical breakdowns. I don't remember seeing anybody. I mean, there's some great people doing it now. Love seeing Brewster stuff. But like you were the first, you kind of pioneered it, because I remember you had like the board drawing lines, and it was like the first time that people were actually putting you know, a quantified approach, or at least of being able to visualize mechanics, right? And so I know you've done so many pictures in your past when you were, you know, I love those things. I don't know how many you're doing now, but you know, where I really got to see like, hey, we need to reach out to this person because we're trying to identify why he has pain. You know, and you know, getting Shohei Ohtani right, and they finally done it. You know, was a big deal. I mean, we did a multi-segmental rotation after I talked to you, and you know, you're saying, you know, his back hip seems restricted, like he's not able to get enough extension off his drive hip, which in turn it doesn't push his hips through enough, and it's possible that he's leaking energy, right? And for a big dude like that, he's a big guy. For people who have not seen Shohei Ohtani, he is a big dude. He is solid, mesomorphic frame, wide receiver, tight end blend. And you know, so I said to our physical therapist, I said, hey, can we do and we all got certified with the SFMA. We're like, can we do a multi-segmental rotation test on him? And we did, and it was interesting. So like you could see his hip flex when he was rotating towards his glove side. And you could see, okay, well, that's weird because, you know, we're rotating in the direction to our glove side to throw. And I'm noticing that he's not able to get hip extension. It's like, okay, we'll get him to rotate the other side. You know, and it's interesting too, because he hits and throws different hands, but he goes to rotate around to the other side, and his landing hip has complete extension, which to me is, you know, and we're talking about strength and coordination. We're going to talk about this here. And that's part of this baseball performance summit that we're putting out with Zach Deschamps. And it's just, you know, seeing those things, it's like, okay, well, we're taking a delivery approach. We're not taking a physical approach first, right? That's why I like you, because you're a strength coach. You're a master of motor skills and throwing, you know, competitive outcomes. But you're looking at the movement, dude. Like, to me, that's your functional movement screen. You know, what does that look like in reality? And then you go back and say, okay, what are the anatomical limiters to that? And is it strength? Is it range of motion? Is it coordination? You know, and that's what we got to do. I'm going to shut up now because I talked for a while.
No, you nailed it. I mean, it's like we're helping guys perform a skill better. So if we can address everything from the issues they have in the skill, then what are we helping them to do? You know, I understand when you go to a strength coach, he doesn't know your skill or how you perform your skill, and he's probably not educated enough in it. So he's just going to help you move better. Totally. But we know the skill, and we know how it works and how it's supposed to work, and we then evaluate you against it. Like you said, it's a movement screen, and then we go, okay, you have these restrictions. Now everything I do, I'm just trying to solve your problems here. Everything I do down the chain is to get to that problem.
Yeah, right? I mean, yeah, man. I mean, here's our tagline: throw fuzz, right? Yours is top velocity. When people think about this, you know, obviously we know the velocity component is a competitive advantage, helps you have better opportunities to be drafted, helps you have better opportunities to play in professional baseball. However, when you're listening to you talk and myself talk, there's a holistic element of player health, right? And consistency, that there's checkpoints. It's just not like, arm speed, arm speed, arm speed, arm speed, arm speed. And in the education that I'm providing, it's really focused on arm position. And the things that you're looking at, anatomically, they affect arm position, right? I think that's why your athletes in your program have a great health opportunity. And you also use our device, which is amazing. So it's all data integrated, but you're keeping them consistent so that arm position's consistent. Like, imagine this: variable arm position, maximal arm speed, right? And I'm not dogging weighted balls because they work for certain people if they're assessed. However, there's no targets. The loading is it's called accommodated loading. Sometimes it's heavy, sometimes it's super light. You're building arm force, you're building arm speed, you're building arm power. But the issue, dude, is that we're not throwing with a purpose when we do those. Sometimes the weighted ball programs are done in isolation without being on a mound. And then all of a sudden, like, we're getting kind of further away from the context of competition. And so what you're talking about, when I'm talking about using data, understanding the motor preferences of the pitcher, focusing and prioritizing arm position through the kinematic chain, it becomes so much more important.
Yeah, because I'm not, and you and I, we're not trying to improve something or enhance something based on just some general understanding on how the system works. Oh, well, arm speed is what increases velocity. So let's build our entire program on this assumption that this is probably how it works, as opposed to obviously getting more empirical in your research and finding real correlations to velocity and health, but also doing something like we do, evaluate the player and evaluate in the evaluation process, take that, run statistical analysis, and get a more in-depth understanding and what is really going to help that player perform better, not just what generally helps everybody, what helps that player through a more in-depth analysis of their problems and a better empirical evidence on what is really the components to performance. The problem is people can't get out of the generalization of performance training. Like, that's not really a good place to be. That's a good place to start, but it's not a good place to develop your career, right?
Dude, the thing is too, that's really hard for me in like what you're saying is that specialists are operating without understanding each other. So you make it simple. Brewster makes it simple. He's a strength coach. He's a pitching guy. He's, control the nutrition, the sports scientist, all in the same person. But then when the athlete progresses and they get to college and now there's more diversified roles, right? Or they go to pro ball and there's even more people in their performance pod. The issue is there's a lack of understanding of what people are doing. And my previous role, I tried to clear that up as the director of performance integration with the Angels. I would say that I'm not a specialist for anything. I'm a specialist in being a generalist.
You're a mediator.
Yeah. Right. But the thing is that we talked about understanding motion and training, and, strength coaches sometimes don't watch the delivery, or they may not spend time to sit down with the pitching coach or the pitching specialist to say, hey man, what is it about this player that they're underperforming or they're experiencing fatigue or pain, just to sit down with that. But take the lens first of what's most, risky for the athlete, like throwing. Pitching injuries are coming from pitching, man. It's very hard to hurt a player in the weight room. I think in the 20 plus years I've been coaching, I can count on two hands guys that got hurt, and they were mostly back injuries. One neck injury because it was an overhead squat and the guy didn't let go of the bar. Okay. Very, very rare. It's pitching. And so there needs to be some element of like sitting down with your coach and trying to identify where are the leakages in the system. And if you got 3D motion capture, you can identify those leakages. But there's a lot of great visual information that you can get to, and then looking at the competitive metrics, you know what I mean? It's like, and you know, you talk about something constantly, and it's interesting because you know, part of your program is propulsion. You know, you really need the drive leg to work well. And what we had found with Louisiana Tech is that the drive leg in a correlation didn't have any kind of correlation to velocity. But this is what we didn't find. Okay. And I might have misled a lot of our viewers on, and the guys are and gals and people that are reading stuff that I put out on LinkedIn, because that's my forum. I like to put higher level information out there. I'm not very good with TikTok or some of the, you know, other social media outlets. But if you lose propulsion, okay,
your velocity goes
now exactly. But the connection,
but you also set your arm up for injury too,
dude. So you know, one of the studies that I have, and it's free, people can download it, it's open access, there's no barriers behind paywall, is looking at grip strength loss with a change in stride length. And stride
I love
length,
that one.
The stride length is just kind of a window into the soul of ground reaction force. You know, intuitively, if you can't push very well, you don't propulse your body, your center mass is not as fast coming off the bump.
Yeah.
The stride length is going to contract, right? Now, here's the crazy thing. With a reduction of stride length, you lower your lower body fatigue. You lower the hormonal changes in your body that indicate fatigue. You lower your blood sugar expenditure when that happens. But mechanically, when it comes to functional strength loss, your arm takes a beating.
Okay?
Yeah.
Well, you know, like, you ever heard the Kibler and Chandler study a long time ago? It was with tennis and baseball.
Yes, with tennis.
It was like a 20% loss in kinetic energy going through the hip and trunk to the arm. You needed a 34% increase in rotational velocity of the shoulder. Just to put the same from the hand. So I'd use that. People, to me, that's math, and it's almost double. So it's almost. I mean, I'm sure it changes when you move up and down energy production, but if you lose 20%, you almost have to double it in your arm just to get the same forces back. I mean, it sounds insane.
No, but I mean, it's insane, but it's intuitive. Like, they've computed that. And
but also too, I saw a study that said 86% of the energy in the ball comes through the trunk.
Right. Oh yeah, because well, the thing is in my research, it's momentum oriented. The trunk's the biggest mass, right? Like, if you had to cut your body up into bits, your trunk weighs the most. So the faster that high mass moves,
more
that's momentum.
Out.
Yeah, right. mass times velocity. So it's actually providing an additive effect for the arm. Now the issue is and we're talking about, you know, stride length and ground reaction force changes. If you lose your ability to be consistent in your push off, right, and you contract your stride length, well, the true compensation is that velocity loss isn't going to be there until they're fatigued. The true compensation means they're maintaining fatigue while they've had this contraction in stride length. So what do? They have to rotate faster, right? Now, if your angular momentum increases, the exchange is altered with the throwing arm. Okay, so now you got a faster trunk, a slower moving arm, it lags. You know, and if you think about, you know, I don't know, if I took a stick and my hand's rotating it, but I held one end and it was just bending, the more leg I put on that stick, you know, the joint's going to take the brunt end and it's going to split. So
also,
you know, that's what happens to our elbow.
I saw a study that said if you fail to create the rotational forces in your lower half, then you're going to have to create them in your upper half. So if you fail to get your pelvis, your legs to drive your pelvis rotation, you're going to have to use your glove side, because it's the only way you're going to create rotation with your upper half. You're going to have to use your glove side to create it. And it's because if your hips created it, your trunk would receive that energy. If your hips don't create it, your trunk has to create it. And the problem is when you yank through your glove, you accelerate so much faster that your arm will never catch up. And then you hyperangulate the whole way through.
Yep. And that's explain hyperangulate, because people might not know that. It's a big word, but it's very meaningful.
especially when your arm drags behind the rotation of your trunk. So it basically hyper, I guess, I mean, hyper is the word. It exaggerates basically in flexion or rotation and in delay behind the trunk. So it's basically riding late or moving late behind the trunk or dragging.
Yep, totally. It's yeah, it's
you know,
a
I think
frightening thing.
Job was the first one to really talk about it. He said Job believed every arm problem came through hyperangulation.
For sure. So, you know, so when you think about it, so anatomically, hyperangulation is caused also by laxity, and laxity causes the humeral head of your arm bone here. This is your humerus. The humeral head's in the shoulder socket. And what happens is when you hyperangulate, the humeral head goes up towards the top, okay, and moves back. Okay, so that means there's laxity in the shoulder. It now can get increased horizontal abduction, so the arm can be pulled way back. You can look down on an athlete. Sometimes you see their elbows are almost touching.
Right.
You know, they're really lax.
If they have a lot of shoulder flexion.
Yeah. You got anterior shoulder pain, right?
Which they say is the worst injury is a anterior labrum tear.
Yeah, it's labrum for sure. And that's the thing, the mechanism for the labrum, people think the labrum tears, you know, at the ball release position, and there are traction injuries that are slap tear oriented there, but the primary slap tears, they come in layback, and when you get the super hyperangulated layback,
it's even worse.
Yeah, the bicep tendon rolls, right? If you took a rubber band, you had two endpoints, and you just started rolling it. You can feel the tension that's pulled,
and then you have the clavicle grinding it. You know, the collarbone up here is just grinding it in that hyperangulate. Just, and you're doing this, you know, you're going, and it's just grinding it.
Yeah. When I started my coaching in Major League Baseball, it was very unusual to find athletes that had internal impingement. People hear about subacromial impingement. So if I have a restriction raising my arm, then what can happen is between my acromion, which is part of like connecting with the clavicle, and the shoulder blade, underneath that, the humeral head can pinch the fibers of of the most superior or the on top rotator cuff. It pinches, right? But when it comes to internal impingement, that's where you're getting the posterior ones pinched, you know, against the shoulder,
the subscap.
Yes, well, the socket there. So like you're getting it basically against the labrum.
Yeah, right.
You know, you're pinching it, and that's coming from a lot of hyperlaxity. And there's another thing that I'm getting into now is circulation training for the throwing arm. There was a study done a while ago that talked about the humeral head having laxity in the joint that can actually compress on the axillary arteries, right? Yeah. And there's so many studies that show, you know, there's one that shows grip strength. That's why we do our pinch test up here, because it shows grip strength loss.
And also
too,
you got thoracic outlet syndrome getting
thoracic
so
outlet
popular,
syndrome,
and it's all linked to it. Yeah,
for sure. And you know,
but you say it right there, like, because this goes into the armcare.com device, the dynamometer. Doing the grip strength test in that position, if your grip strength's way down, specifically to your other arms, if you're, say, this arm's at 40, 30,
right,
and this arm's at 15, it could be related to a pinching of the blood vessel or even the nerve.
For sure. That is huge. Yeah, nerve compression and circulation. And you know, there's been some great studies in Japan that have compared the throwing athlete to the non-throwing athlete, and they look at the blood perfusion of the fingertips, and it's just not even close. Throwing athletes,
I think it's super smart, because to tell people what the negative is about losing blood to the arm, and you don't have to lose it that long, but tell them all the negatives.
No, I mean, there's a ton. Like, you know, your tendons, your ligaments, right? Your ligaments have very low blood supply anyway. So if you imagine, like, the hose is kind of kinked to begin with, and all of a sudden you're squeezing it down even further, there's less nutrition, oxygen, you know, healing factors, all of these things that have to circulate.
You'll even notice if you're a severe case of it, you'll even notice your your muscle mass in your throwing arm could be decreasing
Totally.
significantly to your other arm.
So my hierarchy, and this is, you know, in this course, I got these over.
I think it's the other one.
In the baseball performance summit, you know, I talk about, you know, how to train in a biomechanical fashion, but also to improve the strength of the throwing arm, but it's done through isometric instance. Okay. Now, the thing is, and this is why I like gripping handles, this is why I like hard contraction. When you contract muscles, they clamp on the blood vessels. Like when they, I mean, this is known physiology. You look at a power lifter that does a leg press.
It's called
and
occlusion, right?
Yeah, they occlude it. Your muscles occlude it. So the blood pressure.
Well, it's also why the heart beats faster when you do a full body occlusion.
Right.
Like when you're cleaning, your heart goes boom,
exactly.
boom, boom, boom.
Exactly.
Right.
Well, yeah, you need greater ejection fraction because you gotta like you have to eject more blood. You have to use more force because the diastolic element. So when the vessels are at rest, they're really compressed by all these muscles, right? Now the thing is with the isometrics in the training done biomechanically correct, and especially gripping, you're causing like a pseudo blood flow restriction, like a cuff. And the thing is like when you cause that ischemia a little bit, okay, so you're, you know, that's why we're burning. And, you know, if you hold an isometric contraction for a while, you get rattling, your nerves start to rattle, you know, there's a lack of oxygen. The moment that you come off of that, imagine you're kinking that garden hose, right? And then all of a sudden, boom, you let it go. And it's just like the floodgates open. And what's happening is in the muscles with all those byproducts during the training from the isometric co-contraction, trapping in blood, you got these growth factors that are circulating, you know, because if there's more lactic acid there, you're going to have more a human growth hormone response. There's all sorts of great things that come from decreasing circulation and reperfusion.
You mean
right?
lactic acid can be a good thing?
Local lactic acid. Now, but here's the other thing too, is that the training to achieve that, it shouldn't be rep focused. Like, for example, if you're doing isometric contractions, you're trying to get close to 100% effort, you know, out of the muscles, out of all the muscles squeezing, you know, you're getting it as time under tension. It's different than, and that's why I'm saying this is like non-strength and coordination training, is where I might lie on a table. I got a towel roll under my armpit. I got a pink 3-pound dumbbell. And I'm just doing reps after reps, and I'm talking on the phone, or I'm, you know, that's just basically you're encouraging lactic acid with low contraction. Now, you know, you go on to, you know, using a body blade per se, right? And most of my rhythmic work was with plyo balls, 2 pounds, pound, because I want slower contraction. You know, if you have a body blade, even a shoulder sphere, it's very fast contraction, and it's rhythmic in the sense it's like jogging. You're not getting enough ischemia. You think you are, but it's more for rapid muscle contraction. But if I slow down that contraction by having a heavier implement and perturbation, I'm getting more co-contraction. I'm creating more growth factors. But the key is for me, man, is recruitment and force. Remember, we are a max arm strength company. We don't test endurance right now. And if we do in the future, we're going to look at peak to peak changes in max strength, not the decay. When you look at the decay, that's unlike pitching. You don't throw a ball over 3 seconds where you're looking for the muscle force to decline in the middle of the throw. It's a blink, man, 150 milliseconds. Release the ball. That's all you have. So
yeah, that's why plyometrics is probably better skill specific training. I mean, yeah, you want to be strong, but you're really not getting into performance enhancement until you get into plyometric training.
Yeah, I mean, the throwing is plyometric. You're getting a huge pre-stretch and then explosive action. But the key is, this is where we're missing the boat, man. This is why I got to go back to that course. I want people to take it that we have on that baseball performance summit, is that you need to match the recruitment level in throwing, right? Let's just take your serratus anterior. okay, that muscle alone is contracting over 100% of its maximal voluntary contraction. So imagine 100% that you're trying to press or push, you know, maybe it's a push-up, or maybe there's some kind of other element where they're doing a max MVC, isometric MVC. You're getting more than that when you throw. So it doesn't make sense to have this inconsistent throwing and training paradigm where it's like, okay, I'm going to train like spit, and I'm going to throw like it's an inferno. You need to match the recruitment.
Well, once again, you just defined the failures of the whole past of baseball when it comes to arm care. Arm care has always been at that lower threshold than the game performance level.
Dude, in the title,
So, I mean, am I wrong? Is to throw arm care up to this point until you guys came in has been garbage.
Totally. And the thing is, like, the title of this presentation, because I had to think about it. You're nailing it on the head, because I said, okay, what's the best title I can make for this? And the main title is like giving arm care a facelift, right? When we think of arm care, we think of rehabilitation. We think of, you know, mundane, routine, boring, preventative all the time, injury preventative or protective. Now we're talking about high performance when we talk about arm care, or the way I think about arm care. And I don't know if it needs a different name, but our company.
Well, what you're saying is it's been training under the threshold of the performance of pitching. So if you're trying to do arm care, you actually have to train within the same performance level. Like you have to get the same motor unit recruitment. You got to get the same hormonal response. Everything's got to be the same in your training than it is in your performance. If not, it's not really arm care.
Right. And that's why, you know, that's kind of the lens I want to take with this thing and educate on, is the strength and coordination. We need to start looking at our training, even at a younger age, to have more of a relationship to competing and throwing. Okay. And we do have to stress our athletes in training. Like,
well, but we got to tell them why. And what I know, add to it. Here's why. I saw a study that said up to 140% of your body weight is pulling your arm out of socket, and, you know, distraction at release, 140% of your body weight. So what is I mean, you go in depth. If we're doing light resistance work, how are we getting to that capacity?
We cannot.
That load.
We cannot. And even I'll take one even further. Okay. Arm care, and I'm working on this too, because we're starting to advance our training. Our app is moving at a accelerated rate. It's insane how much is happening in the background. But knockout drills. So for example, high activation and taking your legs out of the equation. Okay, so it's like I go from standing, I go to split stance. You know, I'm starting to ipsilateral, contralateral, or like opposite arm, opposite leg, same arm, same leg. Half kneeling, opposite and same. Tall kneeling, right? Sitting on the floor, quadruped, plank, bird dog, doing heavy loading. Okay. And I've been working on this stuff, man, for a long time. And it's ready now. It's ready. It's getting us closer to forcing our upper extremity to work. You know, we lower what's called a muscle irradiation. So that's why I don't like grip tests where the arm's extended by their side, or even flex at 90 degrees with the elbow tucked to the side, because you can push into your body, you can activate your pec, you can activate your bicep, and it can mask, you know, whatever weaknesses is for your grip, because you're not putting all your effort there. All the electrical energy that's coming from these other muscles, they're feeding the forearm musculature, right? Now, you do this in the arm care training, and you make it like, you know, you got isometrics elements to it. You have eccentrics. I mean, go in a quadruped. You know, anybody who's listening to me, you know, I did this with the college team not too long ago, but you get into a quadruped position, and you raise your arm to a 90-90 level. And I'm not saying long lever, just short lever. And we got some videos of this in some of our arm care IQs. Just take a 10-pound dumbbell, right? Squeeze the 10-pound dumbbell handle as hard as possible. you knocked out your legs, you're on all fours, except you got one arm down, right? You are going to realize how challenging it is, because you are going to find your core is going to light up because it's doing everything. Your arm is so weak there with gravity, no legs to support it. Your body's going to do so many different things to maintain strength. And the amazing thing about that is that you're teaching your core to be stable and to teach your arm to be stable, because there's elements in the delivery where things aren't moving. You know, there's a point where we got to get to with our players to keep them healthy is like, my trunk is facing home plate. Okay. I'm co-contracting the front of me and the back of me to hold position, posture through the delivery. Okay. That has to be there. At ball release, that's an instant of isometric contraction. At the instant of ball release, okay, your arm is fixed in the shoulder abduction position, horizontal abduction for that one instant, because it's got to apply friction to the ball. You can't have a floppy arm everywhere. It's got to, there is an isometric position to it, right? But it also has to come with a stable base. So when I'm in flexion, I'm holding that flexion, you know, and here's ball release. You don't see them dipping down more. Well, it's got to be synced. So, you know, you're creating much more of this strength and coordination type of approach to training, you know, and I'm telling you, man, I look at people's arm care programs, half of them, they're using light band, like pull aparts to death, not using heavy handles, same loading, you know, no attention to internal rotation strength, very limited attention to grip strength. And some of them don't even grip at all. Don't even use bands that grip. So, you know, that are getting elastic strengthening. And it's like, man, I'm worried, because we're treating the throwing arm like it's porcelain as a whole industry.
Grip strength is like, so, I mean, it should be the foundation of upper body strength, right? Shouldn't it start from grip strength and kind of build down?
Oh, well, you definitely, yeah. I mean, like,
how do we define the importance of grip strength to arm strength? It's
so,
got to be one of the most important aspects of it.
So it's interesting, because the way you look at it is like how most high performance people look at it, and it's proximal to distal. So people are like, well, I got to focus on the legs, and then I got to focus on the pelvis, and I got to focus on the trunk, then I got to focus on the shoulder, then I got to focus on the bicep, tricep, then I got to focus on the forearm musculature, then the wrist, then the hand. I think to be effective, to prevent injuries, there has to be a distal to proximal connection. Like, that's why we started with our app that's arm focused. We know the main event, the worst injuries that are caused are at the throwing arm. You're gonna, in my research, you can look at it. You can throw a million different ways, and we've looked at it all the time. You can throw a million different ways. We look at it online, but there is a weakness in the arm, you know.
Well, think about it. If your core it's going to sit here and sling, you know, your legs and core is going to sling all this energy to your arm, and your arm's not as strong, or your wrist is not strong enough to survive that. You're just going to blow the joint out. So you have to almost focus on grip first, because you got to get your grip, a priority, get your grip so strong, because these are smaller muscles. The chances that they're ever going to be able to compete with the proximal segments is poor. So they have to be prioritized up, because if you reverse it and you prioritize the proximal segments, then they're always just going to be so dominating to the strength of the distal segments, that if the distal segments get involved in a case where we have patterns of injury like baseball, then they're never going to survive.
Dude, when I did my volunteer coaching at the University of Buffalo, I started out before I was a baseball coach, a GA as a baseball coach, I was a strength coach, and I worked for Buddy Morris. Okay. Buddy Morris, his name is like, it's a hallmark name. He's the director of like performance or preparation for the Arizona Cardinals. At least the last time I looked, he's been in NFL level positions for a very long time. High level college, but he had this stint where he was fired by the Browns. He was looking for a job, and he came to Buffalo. And the reason why he came to Buffalo is that there's a community of Buffalo people, one being Paul Childress, who trained at Westside Barbell. And for people that don't know Westside Barbell, watch the movie. I think it's Westside Against the World. It is a league of extraordinary human beings that have ridiculous amount of strength. We're talking like 5 to 6 times body weight strength. Ridiculous, okay? Massive humans. So he comes to Buffalo, and I'm learning from him at an accelerated rate. I learned more from him than I did in my PhD program as it relates to human performance and training. There's no comparison. And Paul Childress too, who was there. But the one thing he said is that grip strength is a window into the soul. And he was talking to me. He had some manuals that were translated from Russian to English. And the Russians would use grip strength testing before every lift to identify what the nervous system was like in the training system, in the training session. And like when you come, and we're talking not power lifters, talking about Olympic lifters. And it's a weird thing in Olympic lifting because your training is also your competition, right? So you want to talk about, nervous system overload and frying a person. They have to compete in lifting, and they have to train lifting. It's lifting, lifting, lifting. So if you don't have a good understanding of what's going on internally in the body, and you know what, they are walking around. It's not like they're burning. Some of them don't even have muscle pain. This happens in throwing athletes too. They're like, man, my arm feels amazing. And then they go and test, right? And now it's like, well, why is my total arm strength 20 pounds down? Well, it's because you have nervous system impairment, okay? You don't feel it the same as metabolic or force-driven, but it affects force. Or you have a subjective sense of it. So like when you're hitting the nail on the head, man, the grip strength is a big, big piece of it. And, when it comes to the elbow, proximally, your forearm muscles, the flexor pronator mass, it's trying to protect the UCL.
Yeah.
You don't have grip involved in your training, or if you're only doing full hand grip and you're not isolating pinch grip, which is the flexor digitorum superficialis, the FDS, which I just put something out on LinkedIn, a quick, talking about brachiation, hanging while trying to like cause distraction of the elbow joint, and having your forearm muscles, particularly that FDS, try to keep it together. You don't have things like that, man. It's like, I don't know. It's not helping the Tommy John situation.
You're relying on your genetic ability to stabilize your joints against massive forces.
Yes. And the other thing too, man, is that people don't know is that we talk about varus torque. Okay. So valgus load, and I talk about this a little bit in the course. It's the varus torque is the opposite to the loading that opens up the elbow. Okay. And that happens when we're at layback, right? And it's like having it, if you throw 90, it's like having a 73-pound dumbbell in your hand that's opening up your elbow joint. Okay.
Especially if you're hyperangulated.
Right. Oh yeah, of course. When you talk about the acceleration of the forearm, how fast it's moving back, and its mass, that's a lot of rotational.
So you basically, if you can't counter it in varus torque, then it's gonna fail.
Totally. The only thing that applies to varus torque, it's not the extensors, it's the flexors.
Right.
Right. And the other thing too is if you have strong varus torque, and some studies are showing grip strength relationship to velocity. I think we had a poster that came out of Louisiana Tech that grip strength did have a correlation to velocity. Well, those muscles that apply the varus torque, they're closing up the elbow, the medial elbow, but it's also helping you in accelerating the forearm
and keeping your grip and being able to move your ball and being able to
friction.
And pronation is pronation acceleration drives ball spin. So if you're not getting pronated, which your mechanics are going to have a lot to do with that. If you're pulling open, you're going to have a hard time getting pronated, but your pronators are helping that, obviously. Mm-hmm. So it's going to spin your ball. It's going to do everything.
Dude, yeah. I mean, this is
we're going past your time. So why don't you tell them about the new summit and tell them how to find it?
I know I've talked about it. I mean, if you guys like the stuff that we're talking about in this podcast, you're going to really love this course. It's a low barrier cost. You're not taking a full certification, but you're getting a taste of what's going to be coming along the lines with our certified pitching biomechanist course. So you're going to learn more about movement. And now I'm starting to blend them together with strength and coordination, where you're looking at the data analytics for 3D motion capture of the arm and the data analytics for the strength testing and range of motion testing, and putting them together in a way that makes sense to a throwing athlete. And I honestly, I don't think there's a lot out there on that. And, you know, I was late with the early bird special. That was a big mistake. I somehow missed the email. And right now I put out a promotion that if you use my affiliate code to take the course, the PBS course, and you're within the first 10 people to show me that, you're going to get a reduced rate for a VIP package. So for $750, you're going to get a dynamometer, you're going to get 10 player free accounts, you're going to get the certified arm care specialist course, okay, which, you know, we're pretty much giving you like $1,200 for $750. And then you're going to get discounts on training equipment. But one of the best parts of it is I'm going to give 20 minutes of my time to review your arm care program. Okay, for those first 10, and then the next 30 is they're going to get $500 to go towards their certified arm care specialist course. We need educated people in this. If we're going to fight injuries and we're going to maximize velocity and injuries together, and you're living proof of it, we need to have an educated community. So that's going to be another incentive for people that take the Baseball Performance Summit. There's like 12 presenters. They're all awesome. Dr. Greg Rose is in there. Mike Boyle. There's just some big names, and I'm grateful to be a part of it. But we're also at the ABCA. We're creating a very exclusive club, and we're gonna roll that out. Talking about stuff like this, sharing ideas. Like, I mean, we had a podcast like this. Imagine we had 150 people with these kinds of insights, called the Arm Care Elite, and it's going to be amazing, man. It's where I want to be, with a community, people who are like-minded, driving the ship, you know, creating change in the game, and educating and supporting each other. So I'm pumped about this, and I appreciate you having me on the podcast and allowing me at the time to talk about these educational offers, because I really believe it's needed, man. I really do. I think there's more of this.
I'm always learning from you, and everyone out there I know is probably, we might even be over their heads, but you need to just dive in, go to armcare.com. You know, also here at TopVelocity, we affiliate, we do a lot of stuff together. We're both going to be at the ABCA. I know we're booth 419. Do you know your booth number in the trade show? Or
I don't know, but I'm going to be at the Tech Expo speaking, and I'll have that booth number, and you'll come and listen to some of this stuff. And, you know, we want to see you. You know, yeah. I want to see you. I want people to see us. And I'm hoping that the other people who have baseball performance businesses, they stop by and they take a look at this, because, I mean, you're doing a heck of a job in developing throwing arms that are healthy, you know, and that whole thing is like, you know, we have our slogan, throw fuzz. We've changed it because we do understand we need to, you know, have velocity, high velocity, but we also have our red cross symbol. That's part of our symbol. It's like, we have to do it healthfully. We got to do it surgery free.
There's no other way.
We can do that. We can do that. The player has greater opportunity for everything in their competitive life. And we're going to keep them psychologically happy, man. We don't want people to miss their 18 months in the season. I just talked to a surgeon the other day. 15 months is the best that's going on for kids that are under the pro level. That's 15 months, man. That's a long time for a parent. You're not going to see their child play in the summer. If you're a business owner and that kid's doing, you know, rehabilitation, he's not getting better. You know, we have to do a good job of trying to advance performance and also health at the same time.
Yeah, and the only way that's going to work is if you have a system and a methodology that's built around a empirical approach, an evidence-based approach, which, you know, Ryan comes from that world, is a PhD. I'm trying to get my PhD as well, and also someone or a method and a method that
data
that evaluates their athletes and gives them a roadmap to their specific needs and their specific restrictions. Because if you just blanketly go at this and trying to train for velocity, you could be walking right into your weaknesses, and you'll get faster to injury than you will to performance. And so that's where you need systems like us, because they're healthier, and because of that, they're more successful.
Yep. Amen, brother. Thank you for having me on, dude.
Thank you, brother. It was awesome. We'll do it again. And I'm looking forward to ABCA. I know it's January 5th to 8th. If anybody's looking to come see us in Nashville, it's going to be a lot of fun. So,
Awesome.
all right, man. We'll see you soon. And also, just how can they find you? LinkedIn still the
Oh
best?
yeah. LinkedIn. Yeah. LinkedIn. I'm on there. I even just flashed up my company email in the video I put, Ryan@armcare.com. Real simple. Shoot me an email. I love meeting new people and, hopefully really serve you in the baseball world.
All right, brother. That was good. We'll do it again.
All right.